Hey, welcome back to my channel. I am a medical student, third year medical student, and it's been a long time no see. It's because I was fighting death, like as usual, but not as a doctor, but as a patient, because I have been fighting death since I was born, even before I was born actually. So let me share some story, and then okay, well, I was when I was 7 months in the womb. When I was in 7 months world in the womb, not after the birth, I developed a condition called nuchal cord, and it means that umbilical cord wraps around your neck, just like this, and around baby's neck, and it reduces the blood supply and oxygen supply, and thus causes the fetal distress. But it can be casual or not casual. So in my case, it was casual at first, but it as time passed by, it was developed into kind of serious, and it caused me fetal distress. And also, I was in bridge position. Bridge position means transverse position, not in the vertical position, and thus requiring a C-section for my delivery. And when I was delivered, there is another condition that arose, and it is Dr. Sardiris was closed, completely closed, and I was not crying, I was not breathing, I was turning blue, and the doctor was pushing CPR, and doing everything they could do, but still they couldn't. And then at last, they threw me in a table from a height. They threw me in a table, and it was a story that my mother still says to me, and that's why, well, they threw me into a table, and I cried. And I cried out of nowhere. I don't know how that occurred. So it sounds quite unnatural, right? So I feel like I was not meant to exist. I was not meant to be in here to get a birth and to live a life, and to be a part of the universe. It feels quite different to be like this. And then it was up to birth, and then when I was 7 years old, yeah. When I was 7 years old, I developed pneumonia. You might think that pneumonia is quite not serious, but when it gets complicated with pleural effusion, which means your lungs are full. Your lungs are full of fluid, yeah. Where there should be air, and where there should be air to be exchanged for oxygen supply to every tissue of the body. My lungs were filled with fluid, and thus no air exchange could be done, and my oxygen saturation was dropped down to 30%, and it was quite a serious case. I landed in ICU for a few days, and then again I survived. Remembering these things, it makes me feel like, well, I'm a resilient one. Yeah. And then I thought it was over. Like how many times death would blow me, you know? How many times death will try to take me. Maybe it should be tired by now. I thought so, but yeah. When I was 11 years old, I developed dental caries, right? And then the dental caries doesn't seem so much serious thing, right? But it can complicate again. It complicated into infective endocarditis to me. Infective endocarditis means it's the inflammation of your inner layer of heart, like this. And then, yeah, inner layer of the heart was inflamed, where it can cause the valvular inflammation to valvular deformities to a mitral valve, and that causes the regurgitation, that causes the occasional or that causes progressive heart disease, you know. So yeah, I survived that too. And I thought, well, I will be fighting death my entire life, and that didn't disappoint me, because it came again when I was 17 years old. It was just a random illness, right? Just a seasonal flu kind of illness, where I was feeling itching in my throat while I was sneezing, where I just had a runny nose and cough and difficulty in swallowing, and I went to the doctor, and he gave me a medicine, an antibiotic, cephalosporin, yeah, and fluoroquinolones. The doctor gave me those antibiotics, and it was going quite good until the antibiotics developed some serious allergic reactions to me. And then we didn't know why that is happening, because it wasn't getting healed, right? And then the doctors were so confused until 13 or 14 days of hospital admission, and then the diagnosis was done by gathering different doctors from different departments, and I had developed Stevens-Johnson syndrome, which is allergic reaction, adverse drug reaction, and I can't use any of the antibiotics from now on. Yeah, from then, and I have not used any of the antibiotics yet. And if I did, I will go to an anaphylactic shock and die. Well, that's you wish, right? And then yeah, it was when I was in grade 11, and it did happen that time, and it was so difficult for me to manage the academics, and until then I was not sure about my career, right? I was so confused on physics and medicine, physics and biology, that I should be taking which one of it, because both of them interested me so quite equally. And then when I survived, let's say, because I was 2 days away from death, because multi-organ failure were happening, my liver was infected, my kidneys were damaged, my heart wasn't functioning well, and this lower lip, it was quite big back then, but then these lower lips and these lesions were just those lesions in my previous lips made it flare away, and it is a new lip that grew. It is a new lip that grew. So basically, and then I decided that I should be a doctor, because death is trying so hard to take me. Why not challenge him more by taking his feed, by taking his meal life, obviously, by taking his meal life. So I decided to snatch the life from his throat and put it back to the patients, and that is why I decided to be a doctor, and I'm currently doing MBBS, obviously. And that was the reason, that was the career decision. And then I was like, well, I can't fight this anymore, I can't fight these much illnesses, but I was resilient enough to fight them. But again, when I was 22 years old, back to 2 to 3 months again, yeah, my pain, I was playing basketball, and it developed me pain in my tibia, right? And both of the tibia, bilaterally it was painful, and I thought it was due to the play after a very long time, but it didn't subside, and thus I decided to go to visit to the doctor, and I was found out that I have fibrous dysplasia in my femur. Fibrous dysplasia is kind of cancer, but benign cancer, right? It's like a tumor in the intramedullary, in the inside of the femur, inside of your bone, that cavity. There is a tumor in it, about 7 centimeter big tumor in my left femur, and it caused. It was idiopathic in nature. It is very rare, just like the Stevens-Johnson syndromes to the antibiotics, right? Both of them are rare, and the only treatment was to do a surgery. But to do a surgery, we need to administer prophylactic antibiotics, which I couldn't administer. So basically, I needed to do allergen test for all the available antibiotics, and that's why we decided not to go for a surgery for now, because antibiotics, allergen test, and this and that, it is a very risky thing when I'm not developing symptoms right now. So basically, we should be monitoring the lesion by 3 months and 3 months and 3 months, MRI and X-ray and MRI and X-ray, for quite a lifelong time. And I can't play basketball or any sports that I like, but yeah, still, it's okay. And I'll develop new hobbies, obviously, because there is no options, right? No alternatives. I'm just thriving, and yeah, I will thrive, and I will do everything that I was meant to do. and I have still that zeal, I have that courage to fight everything, because how many times and what else can it happen, right? What else can death do to me again? So I'm fighting it just like this, just like being resilient and balancing my academics with all these illnesses and all those fear trapped inside my head induced by death. At one point of time, I started feeling like death is watching me from somewhere and it is stretching its bow, right, to arc at my heart, to arc an arrow, to shoot that arrow to my heart and take me away, like gently sway me away by taking my soul in its shoulders. And I started feeling so much fear. Sometimes it was hard, it was tough, but it was not impossible. So whatever does not kill us, makes us stronger. Yeah, maybe it makes us stronger, or maybe it makes us weaker sometimes, but that weakness is a prior thing to be developed before we develop courage, because we need to feel every emotions to fight all of this. And I'm not saying anything rubbish or to make a fictional story that I have developed these all illnesses, because that was quite a story of my life that I think the world needs to know and realize that what else can happen, right? And that is it. Keep hustling and you can do it. Even if you are fighting an illness that is terminal, you can do it, you can survive it. It's the willpower, right? It's the willpower, it's in the heart that does things more than the medicine. It's in the willingness to live, it's in the courage to face everything, and that is what makes us stronger. 7 times I have been blown to death, and now I have developed migraine that is also lifelong, and I'm still pursuing this MBBS. Yeah, that's it. All the best for all of your disease conditions if you have any, and take care of your health if you don't have any, and don't be ill because the world needs you. Yeah, everybody, the world needs everyone, each single individual of you. Even when I feel like I'm unnatural and my existence is how do I say it, even when I feel like my existence is unnatural and it is against all the laws of nature or the universe, where universe is sending death to me to get me, because I'm probably causing disbalance in the entropy or something like that, right? Still, I am here fighting and thriving, and I am here for all of you. Yeah, so let's do it together.